Hello everyone, very warm welcome. I am Dr. Masood Khan. Today I am presenting a case, long case, a 70-year male resident of Karachi, normotensive, non-diabetic with no history of smoking, admitted via ER with chief complaint of loose stools, gradual in onset, 6 months duration. According to the patient, he initially experienced 5 to 6 episodes of brown color, watery consistency, large quantity diarrhea, but for last 1 month his number of stools has increased to 10 to 15 episodes per day, with inclusion of 2 episodes at night as well. The diarrhea is episodic and progressive in nature over the last 6 months. Patient symptoms has not increased with any diet, for example milk, wheat products, and his symptoms does not resolve on fasting. Along with complaining loose stools, patient denied any blood, mucus, worms, urgency or incontinence in evacuation. There is also history of abdominal pain, diffuse in character, 4 by 10 in intensity and does not radiate anywhere. Patient also has history of low-grade fever, recorded 100 Fahrenheit, intermittent in character. There is significant weight loss of 5 kg in last 6 months without any change in appetite. Patient denied any history of vomiting, yellow discoloration of sclera, itching, paleness of facial expression, and there is no history of black tarry stools or flesh blood in stools ever. Patient denied any family history of celiac disease, any history of growth retardation, joint pain with loss of memory, any history of tuberculosis and any contact with tuberculous patient. No history of any mass in right iliac fossa or lower abdominal mass. There is no history of polyuria, polyphagia, increased frequency of urination or increased micturition. Patient denied any past history of diabetes, any heat intolerance, weight loss, facial flushing, whistling sounds in chest, no breathing difficulty, chronic epigastric pain that does not resolve upon taking maximum amount of stomach medication. There is no blackening of skin complexion, uncontrolled raised blood pressure, sweating and palpitation. There is no past history of abdominal surgery. Patient also denied passing of large greasy stools difficult to flush, any history of gallstones in past and chronic epigastric pain radiating to back, no history of tightening of skin or difficulty in opening mouth, no history of intestinal lymphoma in past. Patient denied any history of oral ulcers, any follow-up or diagnosis of inflammatory bowel disease in past, any high-risk sexual behavior and any IV drug abuse, any family history of colon cancer, any history of chronic antacid use, laxative abuse, chronic radiation therapy or chemotherapy ever. There is no history of diabetes, hypertension, ischemic heart disease in past. There is no history of traveling, no history of blood transfusions ever. However, he feels weak and has difficulty in doing daily household works using adult pamper. So the differential diagnosis of my patient, that is a 65-year man is with few complaints like chronic diarrhea of 6 months with diffuse abdominal pain, weight loss, and low-grade fever. So my differential diagnosis would be intestinal lymphoma, TB intestine, HIV colitis, and last but not the least, microscopic colitis in an elderly male. Thank you very much.